All right. Hello, you brilliant, bright, and beautiful minds. Welcome back to another episode of the Journey to Medicine podcast. My name is Caleb Van Orden, and this is essentially a podcast where we break down a multitude of different career paths one can take in the field of medicine by interviewing guests in said fields. Today, we are honored to have Kymberly Miller with us. If you could, please, Ms. Miller, could you introduce yourself for the audience?
Sure. So my name is Kymberly Miller, and I work in Yuma, Arizona, and I am the Director of Nursing of a medical surgical unit here in our local hospital.
All right. Thank you so much for being here today. So I guess we're going to start right off with the question. So the first question I'm going to ask is, as far as it relates to your career, being a director of nursing specifically for a medical surgical floor and everything, what in the broad sense is your responsibilities? And then what's your scope of practice?
So my unit is a 90-bed unit. So we have 45 rooms, double occupancy, and then I am in control and kind of responsible for all the nurses, PCAs or CNAs here in the hospital. So I have about, I think, probably 90 to 100 direct reports. So a lot of moving pieces that I have to keep track of. And it's so one unique thing about Yuma is our population in the winter spikes because we get a lot of winter visitors because it's nicer here. So we also see an influx of staff. So people from around the country also come in as agency staff. So that's kind of what I do. I make sure that financially we are on track and doing what we need to. We're not wasteful. And then I deal from anything from starting IVs for nurses, disciplinary things, things, leadership initiatives around the hospital. So it's pretty complex. Yeah,
a lot. It entails a lot, and a lot of people you work that work under you, but can be stressful. So you were talking about like you work in a managerial role, sort of. Also, you do work with patients too, with nursing and everything. So can you just talk about the education you underwent to do that? From like becoming a nurse, did you go the RN to BSN route? Did you go straight to BSN? Did you get CNA certified? And how did you move to a more managerial role in if they required anything?
Sure. So I actually started out years ago as a CNA.
Okay.
And so when I was working as a CNA, I was going to school at our local community college. And so I got my associate's degree then, graduated, took my NCLEX, started working in the field. And then I got my BSN. And then from that, I am now, I want to say almost 5 months away from getting my master's.
Oh, wow.
Yeah, so I have kind of worked my way from the bottom to the top. There was an opportunity to get into leadership. So here in our organization, you only have to have your bachelor's. So it was something that I wasn't sure if I wanted to get into, but I decided, well, I might as well try. And the worst thing is you don't like it, you just do something else. Right. That's the good thing about healthcare. And so I stepped into it and I have enjoyed it since then.
Oh, that's great. Yeah. And so, you went to community college, associates, worked your way up. Did you feel, we had a previous guest who also was in a supervisor or director role for RadTechs. And she said that it was, if you wanted to move up, you need to get like a bachelor's for most hospital systems, what they require. But after that, it's just simply going up. So what made you get the master's after the bachelor's?
So after my bachelor's, I was torn between, did I want to go and become a master's like NP route, or did I want to get into leadership? So I was kind of at that point where I didn't know where I wanted to go. So I was going to go to be an NP, but this opportunity came up and I took it, and then I realized I liked the leadership. So I changed my master's to nursing executive leadership, but I was one class away from clinical. So even later, if I again change my mind, we can still go the NP route.
And that's great for people to know who are interested in nursing and the little complexities of there's so much you can do. You just mentioned a little bit. There's even in the managerial side, different ways you can approach it and what you want to do.
Oh yeah, there's definitely like, I know when I was in nursing school, they always said like the good thing about nursing is you didn't have to know what you wanted to be when you grow up, because there's so many areas of practice that you could go into. So we meet nurses that started in the NICU and then pediatrics and ER, and they worked in surgery and they've done everything. So you kind of, until you find your groove, you really can kind of explore a lot of options.
Yeah, that's great. Honestly, that's what a lot of people like. So overall, like when you started out and you got CNA certified and you continued, what made you want to pursue a career in medicine?
I think I remember when I was younger, my mom always said I should go into nursing, and I was like, yeah, right, I want to be a teacher. And I had all these other ideas. And then, I then stopped going to college and tried to find my way without college and all that. And then when I got back into CNA work, I realized how much I really do like to help people and to make a difference. And it's just that one patient that you might make a difference. It makes all the difference in the world, really, for them. And then for you as a person, it just helping people is really what I think people that get into medicine, they really truly want to help people and care for them.
Definitely attributes you should have if you're striving to be in the medical field. I would agree with that. As far as your position and as a director and everything, are there, or just for nurses in general, what routes are there to advance in your education? You mentioned a couple already with MSN and P, if you wanted to talk about the difference between those, and you talked a little bit why you chose that, and just advancements within the field.
So you can, I mean, there's tons of opportunities. So you can be a nurse at the bedside. You can go into a charge nurse role. So you're kind of responsible for everybody that's on the floor and managing the flow of things. You can go into a nurse educator role. So that is kind of going back and touching base with the staff in terms of like, you know, a new device that comes out or orientation of staff and helping them improve. There's so many different avenues that you can go into. It's kind of crazy how you can just kind of fall down a rabbit hole and you end up in these paths that you didn't even know existed. So there's really a lot of advancement. And if you put the work in and you work hard, people generally recognize it and they'll find a spot for you to go and really develop yourself. And sometimes people go into roles and then they're like, yeah, this isn't what I wanted. So they step back, and that's okay too, you know, and you figure out where else your education can lead you. But you can go all the way up to a doctorate. I mean, so.
Yeah, no, definitely, especially with Arizona MPs and everything, how they're different than other states as far as the recognition and everything. I think it's good to know about the diversity of the field too. Like you said, you can do a whole multitude of things. You can go from med surg to pediatrics to psychiatry, find your flow there. And then also within that, you can also find what level you want to be in as far as responsibilities within that. So that's great. Without talking about, you mentioned the Yuma area, you don't need to talk about the, you know, what company you work for, of course, or anything like that. But what clinical setting are you in? You said the hospital with 90 beds. Do you want to talk a little more about that?
Yeah, so the hospital in general has 400 and some beds. So my department has 90. We are med surg, but also in the middle of this pandemic, we became the unit that handled all the patients. So that's another specialty that we kind of gained. So we became the COVID unit prior to, you know, ICUs, that higher level of care. We took care of them until if they needed to go there. So that's something that I think our unit itself is actually pretty proud of. Not necessarily always wanting to go running into that fire, but we have learned so much. And I think it's a badge that we all kind of, you know, are wearing kind of with pride now.
No, yeah, definitely. And, you know, you got to adapt, especially with the COVID-19 pandemic. I feel like everyone had to adapt and deal with a multitude of things.
Yeah.
And that's the great thing about medicine too, is it's always continuing. It's practicing medicine. It's not like,
yeah, it's not set in stone. It's, you know,
either.
Yeah, we're not changing the theories or anything like that. You know, we're always learning and adapting, and how we treated that COVID in the first wave versus how we just treat it now. We're always learning and evolving. So.
Yeah, and we don't have to if you don't want to. Are you comfortable talking about the pandemic and how that changed the view, especially from your perspective as a supervisor, and how the medicine was?
Yeah, sure, we can talk about that. Yeah. So one of the things I think with the pandemic, it really brought to the forefront is it was something that we had never seen. We didn't even know what we were dealing with. So every day was, you know, an uncertainty. And we were like, well, are we gonna, you know, we went from almost wearing bunny suits and feeling like, you know, in the movie Outbreak or whatever, like we didn't know. And then it kind of, they're like, okay, maybe it's not that bad, but it was a lot of loss, a lot of trauma that I think later on in a couple of years, it'll probably come out a lot more, but it pushed healthcare in general. It really added a lot of stress to it. But I think, speaking from my perspective, is the teamwork. Actually, you bonded with people, doctors, the PTs, the respiratory therapists, those that were there with you in all your crises. You really bonded with them, and I think formed some relationships. But it was definitely, you know, in the beginning we started, give them lots of fluids, and then they're like, no, don't give them any fluids, and then change this and change it. And you were just hoping that we were doing the best and trying to do our best to keep get these people home. That was ultimately everybody's goal, is you want to get them home.
Yeah, and then at the end of the day, that's all you can do is do your best, and that's all you can hold yourself responsible for, is try to be a better you than you were the day before and everything.
Yeah.
You talked about respiratory therapists, doctors. You talked about the team bonding that was created or more fostered during that. Can you talk about in a day-to-day life the individuals you interact with from the medical team of different professions?
Yeah, so we have social workers, case managers who are RNs, but then there's also social workers that help get people home and discharge barriers. We deal with the MDs. You have nurse practitioners here. We have physical therapists, occupational therapists, deal with speech therapy, a lot of radiologists. You have to send them down for CTs, MRIs, so you got to coordinate that. We even have dialysis on the unit, so you have in the hospital, so you have to send them over to that. So that's, I guess, just in a nutshell, everybody that you could encounter on a day-to-day basis. Oh, chaplains too. We have chaplains.
Oh yeah, chaplains. I forgot about that. Yeah, that's something that a lot of people think about, especially because it makes sense, because like you're talking about, there's so much diversity. It kind of makes sense that nurses get to dip their hands in kind of every department and see a little bit of everything in some respect. So now talking about your job specifically as a director of nursing, I wanted to ask about, every job has their pros, every job has their cons. I mean, that's just the reality of work. What are some pros that you love about your job? Because you said you almost considered NP, but then you chose this. And then what are some of the cons still that, just the reality of it?
Some of the cons, I guess, is sometimes dealing with people. It's always a con. It's a pro and a con, right? We all get because we want to deal with people, but then the complexity of people is also, sometimes it can weigh heavy on your heart. So you can see people that are going through stuff and you can't help them, or even patients or families. Like, you just sometimes walk into some fires and stuff like that. So that could be a little rough. That's really the only con, I think, just dealing sometimes with situations that are tricky, and you might, you have to separate you as a worker and then you as a boss, and understand that you can have empathy for somebody, but they still have an expectation. And so you have to, towing that line can be hard. The pros, I learn something new every day. Honestly, there's not a day that goes by that I don't learn a little bit different part of my role or something that I never knew. And people are also the pro too, because you touch people's lives and watch people grow as nurses. I mean, and you watch PCAs, come into their roles better. And, somebody that on their first day, they look like they were going to cry and never come back. And then you see them months later and they're, your rock star. So
yeah, it definitely is like a supervisor role, hiring and seeing that development, as you talked about, even yourself going from a CNA all the way to a director of nursing and getting here at BSN and forward, like that's crazy. And it's cool to see that in others. Yeah. So what is something, and you can answer this two parts if you want, because you do get to double dip your hand in both. What is something that not a lot of people think about when they think of the profession of nursing? And what's not a lot of things that people think about and when you're a director, as far as like hiring on? So what's something that not a lot of people think about is the reality of the job, or you have to do?
I think that in terms of being a director of nursing, sometimes you're sitting in a computer and people think you're just not aware of what's going on or engaged, but really there's so many other things that are going on and pieces of the puzzle that are moving that not everybody sees. So it's very easy for people to get tunnel vision per se and just say, oh, she's just in her office and doesn't know what's going on. And but really you're watching, how am I retaining my staff? The supply cost just went up. So how do I keep my unit functioning and operable? Because at the end of the day, every hospital, every healthcare system is a business. So you have to be able to justify stuff. So that's something I think that is overlooked. And then what was the other part? Sorry.
Just like you talked about it from director side, what's something that not a lot of people think about from the nursing profession is also part of the job?
I think a lot of people don't understand how much nurses probably take home with them. I think the stress of the job. So if you could imagine, if you're in college, you mess up in a class and the professor yells at you. But sometimes with nurses, our mistakes are connected to people. So you could hear from the doctor, you could hear from the social worker how you messed up, you hear from the family. And it's a lot. And sometimes, you overlook that your mistake it's easy to overlook that it's connected to a person and could impact their lives, and how that nurse might handle it. I think nurses needs a little bit of kindness sometimes. We all need to be kind to each other, but we deal with a lot of almost very abusive stuff too. You can go into a room and patients are just, confused and scared, but you're getting hit. Leads to a lot of burnout and a lot of problems. People leave the field because of it.
Yeah, definitely patient provider abuse is a serious
Yeah.
thing with that and all that. So talking about burnout and other stuff that you were just mentioning, everything, it's kind of like triple fold. You've got stressors and tension from the pandemic. You've got stress and tension from, you just mentioned a little bit, inflation and the prices, and the reality that medicine is also a business and you have to balance that. And then also the burnout that's just relevant in the field with high hours, the stress they take onto themselves, and patient provider abuse. How do you seen that in the workplace, and in the future, do you think there's any improvement?
I think when probably about what we considered the second wave of the pandemic, we had a lot of nurses leave the hospital, leave the bedside. It genuinely impacted them. So then that led to a problem of nursing shortage, compounded by there's already not enough nurses projected to meet the population that we need. So that, and I think it's nationwide, was happening. And then we couldn't get agency staff to fill those holes fast enough. And it was just this huge problem. And that going forward will continue to potentially be a problem. Is the need for nurses in every aspect of care is greater than the supply. And so some of the people that are getting into nursing want nothing to do with bedside, because of, it can be stressful, and they just don't want to go into, they find other avenues, like working remotely or being case man, stuff that they're not necessarily at the bedside. So we're kind of struggling right now, trying to figure out how we can, adapt to the needs of our patients who are sick and need us, and also find the staff to take care of them.
It's definitely scary to think about that, because nurses they're kind of like the backbone, honestly, of the medical system, especially the hospital and everything, from what I've observed in like ED departments and everything. So to see that train is kind of scary, because they do so much. Do you think there's any potential like things being fixed in the future, as far as, I know a big problem from people I've talked to is patient ratios, especially going into, and that goes on top of, being understaffed and everything on top of that, responsibilities. We don't need to talk about it, but you've got cases where you've got license being taken with Donovan and other stuff, and all these stressors that are just realities of the current field. On top of that, do you think anything will be legislatively changed, or with something the hospitals need to take from, especially from managerial side, to accommodate?
I think leadership in general, from up to CEOs of hospitals and down, they're aware of their problem, and there's so many different levels to it. So it's a really hard fix. You have patients that need you, and you only have X amount of workforce. So trying to figure out, okay, so if we don't have an RN at the bedside, who can we use to help facilitate that? And I know it's a conversation that's happening on our end. Legislatively, ratios, I don't know how. I know there's a lot of push for it, and I think it's safety-wise is necessary. But the other end of it, and the opposite end, is, well, how do you meet that need? Because we already don't have enough in the workforce. So I think it's a really complex answer that needs to be talked about, and I don't know what the answer is.
Yes, and that's totally fine. That's for other people to figure out, or a combination of community and time. And you mentioned it a little bit too. There's the perfect case scenario, and like what ethically should happen, and then there's just the practical reality of how it needs to be implemented, and it's completely different.
And I think problem solving, they got to figure out how to make them more both connect, but getting there is definitely a long process with a lot of bumps in the roads, and people can come up with these theories and stuff that we should do it this way, but putting it into practice is totally different. And
of course.
Yeah.
So another question, probably a little bit more on a positive note, we'll push it on a little bit happier stuff. What is the work-life balance like for you, especially as a director in charge of so many people and everything? What is that like?
So that can be very hard, I think, for nurses in general, but then as you go up, because you do feel connected. So there's times where I have to remind myself I just need to disconnect. So I have, my husband, my kids, and just trying to find that self-care balance, and where you say, okay, I got to leave work and it will be there tomorrow. So I usually set like, unless we're in the middle of a crisis, but I have a time that I leave, that once this happens, my staff knows that I'm gone, I'm available for emergencies, but also allowing your staff to feel empowered to make decisions when you're not around is the key to having a work-life balance. Because if you can teach them to lead and to manage things efficiently, then they don't need to reach out all the time, and they're leading things well.
Yeah, especially like the best quality for a leader is to be able to empower others and be able to do that. And it's great that you set those boundaries. So kind of what I took from that is like, you need to set that boundary, and you need to just follow through with that. And that's how you can keep a healthy balance.
Exactly.
Yeah, definitely. So as you're pursuing, medicine, you started out as a CNA and everything, you're going through your career and everything. What is something you wish you knew going into it with all the education and everything while pursuing this career beforehand that like good to know, or something like that?
I think I would have liked to know, that's a good question. I would have liked to know all the avenues and what the full potential was and what you're kind of dealing with, like an honest assessment. So when you're in nursing school, you're there in a setting for clinicals and you're getting little snapshots, right? And so just like when I'm around, my employees give me a snapshot because I'm around and I'm watching. But I think it would have been interesting to kind of look more at some of the not so pretty side of nursing or the realities of it. So then you figure out if you're really truly equipped to deal with that, and understanding, again, the people, the actions that you take or the communication that you send out to doctors, or that doesn't work, somebody's life's on the other end of it.
Yeah.
So I think realizing that, because when you're a new nurse, you're like, I'm here to save the world, and I'm gonna, but you don't realize that maybe you're missing something, or this, so you gotta really understand the severity of it too.
You're dealing with lives on your hands.
Yeah.
Yeah, definitely, 100%. So as it relates to nurse, I'm gonna say this one just for nursing in general, and you can talk about it in different aspects if you want to, or different types of professions in nursing. But do you see any changes in the future for the profession as far as education requirements, especially as someone who's hired, scope of practice, or requirements to get into the field and everything?
So there's always that talk about making BSN requirement, BSN nurses,
Okay.
Potentially, and I think in theory it's a great idea, but I mean, those associate degree nurses and some of that are still just as vital and important at the bedside. And some, I don't know that a higher education necessarily equals a higher skill set. I think that we need to, look at that. And higher education is always important, but I don't know if they'll ever get to a point where everybody will be a BSN qualified nurse, or, there's a push for that. But I think education is important.
Yeah, it's definitely about like education is extremely important, but it's also good to know like you can be a very effective nurse at the associate level as RN and everything. You pass your NCLEX just like everyone else.
Right. Yeah.
As far as what was I about to ask? You were talking about education requirements and trying to push to the BSN. Yeah, that was my question. So sorry. Do you think the push for BSN is just trying to create more legitimacy, or just continuing education instead of standard? Or why do you think there is a push or talk of a push?
Maybe it is to give nursing in general just a bigger place at the table. And it's, I have a bachelor, so here I can, I deserve a spot at the table. So it could be something like that.
Okay.
If you look at statistically, nurses are the largest labor force in any hospital, in medicine in general. So they deserve a voice, and that's a push that when you kind of go through your BSN, that's what they're really like, they're saying, hey, you need to advocate and you need to stand up for the profession. So that could be just so we have a seat at the table and seen amongst our peers as an equal.
Yeah, I 100% you guys should be treated as equal and have a seat at the table. And I hope there are organizations and communities that allow that. And that should be definitely the reality. Like I said earlier, backbone of a lot of hospitals from my experience, from what I've noticed. So for individuals who want to go into nursing or even move up in the managerial aspects, if they get a BSN or move up, what advice do you have for individuals who aspire, to be a director of nursing at a med surg floor and everything?
I think that the best advice I could give is just every day to try to learn as much and understand people as best you can. So it's not always the nurse that moves up in the ranks is the one that is, maybe not the best qualified educationally, but they have tried to learn and to deal with people and the avenues of people. There may be something that I don't agree with that one of my employees is saying, but it doesn't benefit. You have to have some emotional intelligence component to it too. You can't just run into you got to pick your battles and understand the big picture and look at the big picture. So if that's what you aspire, you got to pay attention to a lot of things around you. Even I was a CNA and I worked in a nursing home, and I learned a lot of tricks as I was just a CNA, just by observing. So observation and watching how people do that and tweaking it to your own experience is definitely beneficial, and being a team player and understanding that sometimes you're going to have a horrible shift, but if you help work together, you're going to get through it and you'll be all right. So
as someone who's been in the field for a long time, can you talk about if it's different depending on the state or regions of the country in the United States, and how nursing is differently done, or is it pretty much standardized because of national NCLEX boards and everything?
So the national NCLEX it's standardized, so it's supposed to, and the NCLEX is just measuring like, can you practice safely, and then you learn all the other stuff as you go. So I'm not too familiar on other states like scope of practice and stuff like that. I know the differences between MPs are very different. Some have full practice authority where others have to practice under. So there's always little pieces of your practice that you have to, and your board of nursing will kind of define, like, that's kind of where you got to go to, like, okay, the board of nursing says I can do this and I did this, so you're kind of okay. It's when you start deviating from that that you get yourself in trouble. So
as someone who's responsible for the hiring and firing of multitude of employees for a multitude of reasons, what is something, the first question I'll ask is, what are you looking for in someone when you're trying to hire them? What are you looking for?
I am looking for someone that is here to take care of people, that has that connection. Anybody, and it sounds weird, but you can teach a monkey to do anything, right? So I could teach you in a couple of days how to go and do a med pass, or so you can teach tasks, but you can't teach care. So you can't teach people how to care for somebody. And that's ultimately usually will shine through when you interview people. You can ask the question, why do you want to become a nurse, or why do you want to work here? And usually their answer will make you realize that they are truly caring. So you need somebody that understands that person in the bed. Anywhere is not here because they want to be here and they're going through maybe the hardest time or maybe the best time in your life. You don't know, but you have to be able to put yourself in their shoes.
Oh, totally makes sense. And as you see a lot of people, moving up or growing into the profession or joining the profession, what is one thing you see in those that struggle? Is there a common trait or just a common theme with those that struggle?
It's usually a lack of caring, of understanding. It's just, I'm here to do a job and I need to do this and I need to check it off. And they forget that, healthcare is one of those only fields that we ask you to be super vulnerable within like 2 minutes of meeting you. I mean, we're going to come in and we're going to say, hey, we need to do this, this, and this. And it may be the most uncomfortable thing, that you have to do, but we have to gain your trust fast. And just treating it like a job is sometimes one of the things that makes it not successful, because you don't have a connection to what you're doing.
Definitely. Is there a common misconception that people, like, I would assume people, when they go to the hospital, when they go to patient setting, that they assume something falsely about nurses or stigma or anything that this is not the reality?
So there's like the nurse ratchet thing, right? They all think that we're all grouchy and we're here to make their stay miserable. We don't, but I promise you it's not. Sometimes there's, we have to operate under doctor's orders and stuff like that. And we have to fight those fights to try to get, pain medication. We want you to be safe and, we're going to advocate for you to the best of our ability, but sometimes their hands are tied. So we're really not trying to make you miserable when you come to the hospital. And sometimes we're the ones delivering the bad news, right? Like,
Yeah.
you can't eat for the next 12 hours. I'm really sorry. And then all of a sudden, doesn't matter, you just ate 5 minutes before, you were the thirstiest, hungriest person ever. And, we try to make it as easy as possible, but we really are not there to make your life miserable. We want you to get better and feel better.
100%. It's really important to, like, break down that barrier, because by patients or other people, individuals just in general, realizing that the nurse is there for them and to be a patient advocate for them, like you were talking about, can really help increase level of care and create that bond and trust a lot better, especially.
Yeah. And when, your nurse says, like, this is what's going on in your body, please, nobody ever say, well, I'll wait to hear it from the doctor. It really hurts our feelings.
Yeah.
The doctor will say the same thing, and then we're like, okay. So, I mean, we don't claim we're never going to diagnose you with anything. We're never going to go beyond what we know. But we try to educate you the same way the doctor would, because that's where nursing is centered, right? So we're here to educate, and then
No, yeah, definitely. You're there to do all those things and be there for the patient. Do you have a very impactful situation? Of course, don't violate HIP or anything like that. Like an experience that you had that really touched you in your career so far and shaped you to what you've done today.
I think there's always patients that you remember. I had a patient during one of our surges, and she was deaf, and her daughter wasn't here. So it was, she was kind of going not the right way, and just the fear that she had. And so she was deaf and then also spoke another language. So it was multifaceted, and we had to tell her some bad news through a computer. But I think that's when that human connection and just holding a hand can help. I think that there's people always touch your life in different ways, and you always remember the good, the bad, the laughing with the families, and you remember the crying too. So I think everybody touches you in a different way. But those moments in interacting with people definitely will reinforce your desire to be in this field.
And then, yeah, like you've been talking about, why not the only reason, a big thing about the field is the seeing the impact you get to do.
Mm-hmm.
And that can be immense. Well, not the only reason, definitely a great reason to join the field.
Yeah.
So this last question I have before, if you want to introduce anything else, I'm going to ask just a quick, like, if you had to give like a quick sales pitch of why, there's a shortage for nursing. Why should someone want to join the profession? Of course, for the right reasons,
Mm-hmm.
and the benefits of the field. Why should someone seek it if they're trying to figure out what they want to do in medicine?
I think people should join the field of nursing because you get to interact with people. You get to meet people from all different walks of life who make you aware and see things through a different lens every time. So you acknowledge that you may not agree with them, but you can definitely learn so much in nursing. You can learn from the doctors. You can learn from your PCA who has, been there for 20 years in the same hospital, and she's going to teach you something. So I think if you want a field that you can learn, nursing is it. Like, there's so much to learn and gain, and I think it makes you a really good person at the end of it. I think that it's not just about getting involved with because you care about people, but you want to learn, and how can you make somebody's experience better? How can you make their lives better?
Definitely. My sister's actually going to be graduating from a nursing program at ASU this December. And I think she has all those qualities, honestly, the constant need to just want to learn, the compassion for people. And in general, she's very empathetic and all those things. So it's great to know that there's people like you in that field that she's joining and everything. And those values are very much there. And I think that very much aligns with her.
Yeah.
Did you have anything else you wanted to talk about as far as your profession or anything like that, or something you wanted to mention?
I don't think so. I probably talked a lot already, but no, I don't have anything else that I can think of.
You're fine. You're fine. Yeah. So you're more than welcome to stay. I'm just gonna hurry and do a conclusion and for the podcast and everything. So before we do the outro, I typically do a quote about medicine, because everyone on this podcast, generally in the audience, for those trying to pursue medicine. So the quote today is going to be from Hippocrates. It's going to be, as to diseases, make a habit of two things: to help, or at least to do no harm. All right. Well, thank you so much for watching all the way through, you brilliant, bright, and beautiful minds. I hope you find this episode super enlightening on the career of nursing and also specifically the managerial side and the side such as director of nursing, especially for med floor, surge floor, as we talked about today. Thank you so much, Kymberly Miller, for joining us for the podcast. I appreciate your time, especially because you're at work and everything. It does mean a lot. Again, if you'd like to be a guest on the future episode or even suggestions on what medical profession we should interview next, please email us at journey2medicine.podcast@gmail.com. Again, that's journey2medicine.podcast@gmail.com. The 2 in that is going to be the number 2. Of course, please subscribe to the podcast and share with your friends and family. As always, see you next time on the Journey of Medicine. My name is Caleb. Peace.